Metastatic pancreatic cancer is a dismal disease. Even with modern chemotherapy regimens, patients generally live less than a year. Historically, most do not receive second-line treatment. There are no targeted therapies for this disease in a biomarker-selected population validated by a phase 3 trial. 4 to 7% of pancreatic cancer patients harbor a germline BRCA1 or BRCA2 mutation. They obtain an increased benefit from platinum-based chemotherapy. Maintenance treatments aim to delay disease progression following chemotherapy without compromising quality of life. Olaparib is a PARP inhibitor that targets cancer cells that have a defect in DNA damage repair. The study design for POLO is shown here. Eligible patients had metastatic pancreatic cancer and a germline BRCA1 or 2 mutation. Patients had received at least 16 weeks of a first-line platinum-based chemotherapy without progression. There was no maximum limit to the duration of chemotherapy. 38% of the identified germline BRCA-mutated patients had disease progression, were ineligible, or declined randomization. The remaining patients were randomized 3-2 to olaparib tablets, 300 mg orally twice daily, or placebo, and continued until investigator-assessed disease progression or unacceptable toxicity. The primary endpoint was progression-free survival by blinded, independent central review. Progression-free survival was measured from time of randomization, which was after the completion of first-line chemotherapy. Progression-free survival was 7.4 months on the olaparib arm and 3.8 months on placebo, with a hazard ratio of 0.53 and a p-value of 0.0038. This represents a 47% decrease in the risk of progression or death. The objective response rate by blinded independent central review in patients with measurable disease was 11.5% for placebo and 23.1% for olaparib, which included 2 complete responses. Time to onset of response was earlier in the placebo arm, suggesting that these responses were a carryover from first-line platinum-based chemotherapy. What is truly remarkable is that the median duration of response to olaparib in these patients who had metastatic pancreatic cancer was more than 2 years. In conclusion, maintenance olaparib provided a statistically significant and clinically meaningful improvement in progression-free survival to patients with a germline BRCA mutation and metastatic pancreatic cancer whose disease had not progressed during platinum-based chemotherapy. Interim survival data showed no difference between arms. We are still awaiting final survival results, which will be evaluated at 69% data maturity. Maintenance olaparib was well tolerated with an AE profile similar to that seen in other tumors. Health-related quality of life was preserved with olaparib treatment and showed no difference between arms. Our results are the first from a phase 3 trial to validate a targeted treatment in a biomarker-selected population of pancreatic cancer patients, highlighting the importance of germline BRCA mutation testing in this setting. We conclude that a strategic approach of first-line platinum-based chemotherapy followed by maintenance olaparib treatment should become a new standard of care for patients with metastatic pancreatic cancer who have a germline BRCA mutation.